Hello, this is Dr. Jazayeri. I wanted to talk to you today about otoplasty or ear setback. Occasionally I see patients that come in for a consultation for other parts of the body and they have their ears are sticking out like that. And I'm so distracted by that ear. So after I do the consultation, I don't want to sound like I'm trying to sell them anything, but I always ask them, well, is there anything else bothering you? Would you like to talk about anything else? And they usually say no. So for the longest time, I assumed that these patients are just not bothered by it. But then, in our office, we have a TV with a loop system. So it talks about procedures and we have before and after photos. And a lot of patients tell me that, oh, we didn't know there was a procedure to fix this. My so-and-so, my nephew or my niece has this issue in school and she's always he is very shy. So I thought, I'll talk about this procedure. So a few things about this procedure. The otoplasty has to be delayed until the patient is at least 8 years of age. The reason is that our ears continue to grow and then it stops growing about that time. So if we do the ear repair before that and the ear starts growing, we potentially can undo whatever we've done. The second point is that the procedure can be done under local anesthesia, which is less expensive and safer for the patient. In my technique, at least, the incision is right here behind the ear, so it's unless you look at the ear here, you're not going to see the incision. In some patients, the earlobe is also large, and so if we do the ear setback, it actually exaggerates the prominence of the earlobe. So in some patients, we have to do not only ear setback, but also earlobe reduction. After the surgery, there's a protective head dressing, okay? It's pretty bulky just to protect the ear repair for the first week. So we always tell the patients to be aware of that. This is one of those procedures, probably one of the few procedures in plastic surgery where the result is pretty much permanent. We do use permanent sutures to hold everything together, but occasionally, sometimes the sutures give up. There's about a 1% revision rate or recurrence rate for this procedure, which is very good. The most common mistakes that I've seen is the ears are set back too close to the head. Because it's really easy to do, right? You just put sutures, you tie them, and you're done very quickly. Well, the trick is to get it look normally. There has to be a certain distance behind the ear to make it look natural. The other thing that I've also seen is called a telephone deformity. So the ear, the center part is stuck, and then the top and the bottom stick out like this. So if this was the left ear, it would be flat, and then the top and the earlobe will stick out. And if you don't know why it's called a telephone deformity, most of you probably don't know, you can look up old rotary telephones on the internet and you'll see what I'm talking about. It looks like a telephone handle. There is a procedure for this. It's a great procedure. I love doing it. It's amazing to see how patients, especially in the younger group, their confidence level just goes up. So we have a lot of before and after photos on our website. If you like to look at them, please visit www.drjaz.com, drjaz.com. Thank you and have a nice day.